If you're over 50 and your legs feel heavy, tired, swollen, or cold, especially at night, this isn't just getting older, it's your circulation quietly slowing down. And here's the scary part most people don't realize. Walking more doesn't always fix it anymore. In fact, for many adults over 50, the wrong type of movement can actually make leg circulation worse. But the good news is this: your body still knows how to restore healthy blood flow. You just have to speak its language. Today, I'm going to show you 5 simple, safe exercises that target circulation at the exact places where blood flow gets stuck after 50. No gym, no jumping, no pain. Just movements that wake your legs back up from the inside out. Poor leg circulation doesn't usually start with pain. It starts quietly. Maybe your feet feel cold even in warm weather. Maybe your socks leave deep marks around your ankles. Maybe you notice stiffness when you stand up after sitting. Or maybe your legs feel restless at night, like they just won't settle down. These are not random issues. They are signs that blood is having a harder time traveling back up from your feet and calves toward your heart. As we age, several things happen inside the body at the same time. Blood vessels become less elastic. The tiny valves inside the leg veins, the ones that help push blood upward against gravity, don't close as strongly. Muscle mass in the calves and thighs slowly declines. And long periods of sitting, which are very common after 50, reduce the natural pumping action that keeps blood moving. Here's something most people are never told. Your legs don't rely on your heart alone for circulation. They rely heavily on muscle movement, especially in the calves, ankles, hips, and glutes. Doctors often call the calves the second heart because every time they contract, they squeeze veins and push blood upward. When those muscles don't activate fully, blood pools in the lower legs. That's when swelling, heaviness, cramps, and numbness begin. That's why simply walking isn't always enough anymore. Walking uses momentum, but it doesn't always fully activate the muscles that pump blood efficiently, especially if your stride is short, slow, or stiff. What your legs need instead is targeted movement that opens blood vessels, activates muscle pumps, and retrains circulation pathways that weaken with age. The 5 exercises you're about to learn do exactly that. They are gentle, but extremely effective when done consistently. You can do them at home, on a chair, or even while watching TV. And if you've been told to take it easy because of your age, arthritis, or balance concerns, these movements are designed with safety in mind. Before we start, one important note. If you have severe vascular disease, active blood clots, or uncontrolled heart conditions, always follow your doctor's guidance. But for the vast majority of adults, over 50 with mild to moderate circulation issues, these exercises are not only safe, they're often recommended by physical therapists and vascular specialists. Let's begin with the first exercise, and this one might look almost too simple, but don't underestimate it. The first exercise is slow ankle pumping. This targets the smallest but most critical circulation pathways in your lower legs. Sit comfortably in a chair with your feet flat on the floor. Keep your back relaxed and shoulders down. Now, slowly lift the front of your feet so your toes come up while your heels stay on the ground. Hold for 1 second. Then gently lower the toes and lift your heels so you're repressing the balls of your feet into the floor. Hold again for 1 second. That's 1 full pump. What's happening here is powerful. Every time you lift and lower your feet, you're squeezing veins deep inside the calves and ankles. This helps push stagnant blood upward and signals your nervous system to reopen tiny blood vessels that may have narrowed over time. Do this slowly for 1 to 2 minutes. Breathe naturally. If you feel warmth, tingling, or a gentle pulsing, that's circulation returning. Many people notice their feet feel lighter and warmer almost immediately after this exercise. That's not placebo. That's blood flow improving. The second exercise focuses on the calves more directly and builds on the first. It's called seated calf raises. Stay seated, but now place your feet hip-width apart. Slowly lift both heels off the floor as high as you comfortably can, keeping your toes down. Hold for 2 seconds at the top, then slowly lower your heels back to the floor. Move with control, not speed. This exercise strengthens the calf muscles that act as your body's natural blood pump. When these muscles get stronger, they help move blood upward even when you're sitting or standing still. Aim for 15 to 20 slow repetitions. If that feels like too much at first, start with 8 to 10 and build up gradually. What makes this especially effective after 50 is the slow pace. Fast movements don't give veins enough time to fully compress and release. Slow, controlled raises create a stronger pumping effect and improve vein valve function over time. Now let's move to the third exercise, and this one targets a place most people ignore: the hips. Hip stiffness is one of the biggest hidden contributors to poor leg circulation. When the hips don't move well, blood vessels that pass through the pelvis get compressed. That slows down flow to and from the legs. For this exercise, sit tall in your chair. Lift one knee up toward your chest as far as comfortable. You don't need to force it. Lower it back down slowly. Then switch to the other leg. Alternate sides in a smooth, controlled motion. This gentle marching movement opens the hip joints, activates deep muscles, and improves blood flow through the upper leg arteries and veins. Try for 10 to 15 lifts per side. If balance is a concern, keep your hands lightly on the chair for support. Many people are surprised by how much relief this brings. That's because you're not just working the legs, you're clearing the main circulation highway that feeds them. At this point, your legs may already feel different, warmer, lighter, less tight. That's exactly what we want. We still have 2 more exercises to go, and these are especially powerful for reducing swelling, nighttime leg discomfort, and that heavy feeling that shows up after a long day. The 4th exercise is one of the most underrated circulation movements for people over 50, and it works especially well if you deal with ankle swelling, shin tightness, or that full feeling in your lower legs by evening. This movement gently combines muscle activation with gravity to help drain pooled blood back toward the heart. You'll start either seated or lying down, whichever feels more comfortable. If you're seated, lean back slightly in your chair. If you're lying down, bend your knees a little for comfort. Extend one leg straight out in front of you. Now, slowly rotate your ankle in a full circle, clockwise for 5 slow circles, then counterclockwise for 5 more. Move through a comfortable range, not forcing anything. Then switch to the other leg. These ankle circles stimulate circulation in the smallest blood vessels and lymph channels around the ankles and feet. That area is often where fluid collects first when circulation weakens. Rotating the ankle from multiple angles helps reopen pathways that simple up and down movements can miss. Many physical therapists use this exact exercise to reduce swelling and stiffness in older adults. If your ankles feel stiff at first, that's completely normal. Over time, as circulation improves, these circles will become smoother and easier. You may even notice that your shoes feel less tight by the end of the day when you do this regularly. Now let's move to the 5th and final exercise, and this one ties everything together. It targets the largest circulation supporting muscles in your lower body, the glutes and upper thighs, without putting stress on your knees or lower back. For this exercise, sit toward the edge of your chair with your feet planted firmly on the floor. Press your heels down and gently squeeze your glutes, as if you're trying to lift yourself slightly without actually standing up. Hold that squeeze for 3 seconds, then relax. That's 1 repetition. What you're redoing here is activating muscles that help push blood upward from the legs and stabilize the pelvis. Weak glutes are very common after 50, especially if you've spent years sitting for long periods. When these muscles don't engage, circulation has to work harder against gravity. Even small, controlled contractions can make a big difference. Aim for 10 to 15 slow squeezes. Focus on breathing normally and keeping your shoulders relaxed. You should feel effort in your hips and upper thighs, not strain in your knees. When you finish this exercise, take a moment to notice how your legs feel. Many people describe a gentle warmth, a subtle pulsing, or a sense of lightness. Those sensations are signs that blood flow has improved and pressure inside the veins has decreased. Now, here's where everything comes together. These 5 exercises work best when they're done consistently, not intensely. You don't need to do them all at once if that feels overwhelming. Even doing 2 or 3 of them in the morning and again in the evening can significantly improve circulation over time. Many adults over 50 notice reduced swelling, fewer leg cramps, warmer feet, and better comfort at night within a few weeks. One important thing to understand is that circulation responds to repetition, not force. Pushing too hard can actually cause blood vessels to constrict. Gentle, rhythmic movement encourages them to relax and open. That's why these exercises feel calming rather than exhausting. You may be wondering when the best time to do these exercises is. Morning is great for waking up circulation after a night of stillness. Evening is especially helpful if you've been sitting or standing for long hours during the day. Some people even do ankle pumps and circles in bed before sleep to reduce nighttime leg discomfort. Hydration also plays a role. When the body is dehydrated, blood becomes thicker and harder to move. Drinking enough water throughout the day supports everything these exercises are doing. You don't need anything fancy, just steady, regular hydration. Another factor many people overlook is breathing. Slow, deep breathing helps circulation by gently changing pressure inside the chest and abdomen, which assists blood return to the heart. While doing these exercises, avoid holding your breath. Let your breathing stay smooth and relaxed. If you're dealing with conditions like mild varicose veins, prediabetes, or stiffness from arthritis, these movements are often easier to tolerate than walking or standing exercises. They reduce joint stress while still improving blood flow, which is why they're commonly recommended in rehabilitation settings. As circulation improves, you may notice changes beyond your legs. Some people report better balance, less lower back stiffness, and even improved energy levels. That's because good circulation supports nerve function and muscle recovery throughout the body. The key is patience. Circulation issues develop slowly, and they improve the same way. Think of these exercises as daily maintenance for your legs, just like brushing your teeth is maintenance for your mouth. Small actions, done regularly, protect you from bigger problems down the road. We're almost at the end of the main content, and there's one last piece that can make these exercises even more effective. A simple habit most people overlook that can dramatically support leg circulation after 50. That overlooked habit is how long you stay still. Even if you do all 5 exercises perfectly, long periods of sitting or standing without movement can quietly undo the benefits. After 50, blood doesn't rebound as quickly from inactivity. Veins rely on regular muscle contractions to keep blood moving. And when those contractions stop for too long, circulation slows again. You, Dan Teen, need to become more active overall. You just need to interrupt stillness more often. Every 30 to 45 minutes, gently move your legs in some way. Stand up and shift your weight. Do a few ankle pumps while seated. Take a slow walk to the kitchen and back. These small interruptions remind your circulation system to stay engaged. Think of it as tapping the system awake before it falls asleep again. Another simple but powerful habit is how you position your legs when resting. When possible, slightly elevating your legs, even just a few inches, helps gravity assist blood return. You don't need to lie flat or stack pillows high. A gentle elevation while reclining is enough to reduce pressure in the lower legs. Footwear also matters more than most people realize. Tight shoes or socks that dig into the ankles can restrict blood flow right where it's already weakest. If you notice deep marks around your ankles at the end of the day, that's a sign circulation is struggling. Choosing looser socks and comfortable shoes gives blood and fluid room to move. Temperature plays a role as well. Cold causes blood vessels to narrow, which can worsen symptoms like numbness and stiffness. Keeping your feet and lower legs warm, especially in cooler months or air-conditioned environments, helps blood vessels stay relaxed and open. As you make these small adjustments and practice the 5 exercises consistently, your body begins to relearn healthy circulation patterns. Veins respond, muscles strengthen, blood flow becomes more efficient. And over time, the symptoms that once felt like just aging often fade into the background. It's important to understand that poor leg circulation isn't a personal failure, and it's not something you have to accept as inevitable. It's a response to changes in muscle use, vessel flexibility, and daily habits, all of which can be gently influenced, even later in life. Many adults over 50 regain a sense of confidence simply because their legs feel more reliable again. Standing up feels easier, walking feels steadier, nights become more comfortable. These are quality of life changes that matter. If you're just starting out, keep things simple. Choose 2 or 3 exercises and practice them daily. Add the others as your comfort and confidence grow. Consistency will always matter more than intensity. And remember, your body is designed to adapt. It doesn't stop responding just because of age. It just needs clearer signals, and these movements provide exactly that. If there's one thing I want you to take away from today, it's this. Your legs are not failing you. They're re-asking for the right kind of movement. Poor circulation after 50 isn't about doing more, pushing harder, or forcing your body to act young again. It's about working with how your body functions now. Those 5 exercises may look simple, but they speak directly to the systems that keep blood moving: your muscles, your joints, and your nervous system. When you practice them consistently, you're not just relieving symptoms like swelling, heaviness, or cold feet. You're protecting your independence, your mobility, and your comfort in everyday life. Start small. Even 5 minutes a day can make a difference. Pay attention to how your legs feel when you wake up, when you stand, and when you lie down at night. Those changes matter, and they add up faster than most people expect. If this video helped you understand your body a little better, share it with someone who's been struggling with tired or uncomfortable legs. These are the kinds of tools everyone deserves to know about, especially as we age. Take care of your circulation, and it will take care of you.